What you eat for breakfast may be affecting your body far more than you think. Before you take another bite of breakfast tomorrow morning, I want you to try something. Look down at whatever you are about to eat. Now, imagine what is actually happening inside your body right now at this exact moment before you even finish chewing. Because if that breakfast is oatmeal, whole grain toast, a bowl of cereal, or even a glass of orange juice, there is a very real chance your blood sugar is about to rise faster than if you had eaten a chocolate bar. And the unsettling part is that most people never realize it is happening. But your body does every single morning. And those mornings add up. Day after day, year after year, your body is quietly responding to the first meal of the day in ways most of us were never told about. I am Dr. Megan Foster, and I have spent over 2 decades working with patients struggling with metabolic conditions, including type 2 diabetes and insulin resistance. And in all those years of clinical practice, one pattern has surprised me more than almost anything else. The people trying the hardest to eat healthy are often the ones unknowingly triggering the biggest blood sugar problems every single morning. Not because they're making bad choices, not because they are lazy or uninformed, but because the information most of us were given about what makes a breakfast healthy is seriously, dangerously incomplete. Stay with me through this video because by the end of it, you are going to understand exactly what is happening in your body every morning when you sit down to eat. You will know why the breakfast advice most of us grew up with may have been working against you the whole time. And you will have 5 specific, practical, research-backed breakfast strategies that metabolic researchers consistently find produce the most stable, lasting energy throughout the entire morning. The 5th one surprises almost everyone who hears it. So please stay until the end, because that is the one that tends to make the biggest difference for people. Let us start with a question that almost nobody stops to ask. Why do so many people who eat a full breakfast, a real breakfast, not just a coffee, still feel mentally foggy, tired, and hungry again before 10 or 11 in the morning? Think back for a moment. Maybe 10 years ago, maybe 15 or 20. Back then, did you wake up obsessing about snacks before noon? Did you feel shaky or desperate for a second cup of coffee before the morning was even half over? Did you feel that sharp drop in energy right when you should have been at your most productive? Most people did not feel that way back then. But today, that mid-morning crash has become so common that most people just accept it as part of life. You eat breakfast, you feel okay for maybe an hour, and then it hits. The foggy thinking, the drop in mood, the irritability that comes from nowhere, that urgent, almost desperate need for something sweet or something caffeinated to pull you back up. And most people assume this is just normal aging, that it is just how their body works now, that there is nothing they can do about it except manage it with more coffee and better willpower. It is not normal. It is not inevitable, and in the vast majority of cases, it is not something you are stuck with. What it is in most cases is a completely predictable biological reaction to the first meal of the day. A reaction that follows the same pattern driven by the same mechanism in millions of people every morning. And once you understand what is driving it, you can change it. Not with supplements, not with extreme diets, not with anything complicated or expensive, just by understanding what is happening and making a few informed choices about what goes on your plate. So let us talk about what is actually happening inside your body. I want you to picture your bloodstream as a highway. Glucose, which is just the scientific name for blood sugar, is the traffic moving through that highway. When everything is working the way it should, that traffic moves steadily and consistently. Cars enter at a manageable pace. The highway stays clear and everything flows. When your glucose is stable like this, you feel it. You have energy that lasts. You think clearly, your mood is even. Your body is doing exactly what it was designed to do. But now imagine what happens when you eat foods that break down into glucose very quickly. Foods like white bread, most commercial breakfast cereals, instant oatmeal, fruit juice, flavored yogurt, bagels, muffins, many granola bars, and even some foods marketed specifically as healthy breakfast options. These foods contain carbohydrates that your digestive system can convert into glucose extraordinarily fast, faster than your body was designed to handle comfortably on a regular basis. When you eat these foods, it is like suddenly releasing hundreds of cars onto that highway all at the same time with no warning and no coordination. Traffic surges. The highway becomes overwhelmed. Your body reacts immediately. It releases a hormone called insulin. Think of insulin as the emergency traffic management system. Its entire job is to respond to that surge to clear the highway by moving glucose out of the bloodstream and directing it into your cells where it can be stored or used as energy. Now, insulin is not a bad thing. It is an essential hormone. Your body absolutely needs it. The problem arises when the glucose surge is so large, so sudden, and so frequent that the system is being repeatedly forced into emergency mode. Because here is what happens when the traffic surge is very large. Insulin does not respond gently and gradually. It responds aggressively to clear the road as fast as possible. And it does its job effectively, but it often overshoots. The highway clears faster than it should, and blood sugar drops lower than it should. That drop, that sudden emptying of the highway after the surge, is what you feel as the mid-morning crash. Energy rises sharply, then it falls sharply. And your body, sensing the drop in blood sugar, sends urgent signals that feel like hunger, fatigue, difficulty concentrating, and the craving for something sweet that will bring blood sugar back up quickly. And if you respond to those cravings with more fast-digesting carbohydrates, which most people do because that is what the body is asking for, you begin the cycle again. Spike, crash, repeated every few hours throughout the day. Over days and weeks, this pattern is uncomfortable and draining, but over months and years, it becomes something more concerning. Let me explain why. Every time blood sugar spikes sharply, insulin has to work harder, and every time insulin works harder, your cells are being exposed to high levels of it repeatedly over time. Eventually, a process begins where your cells start becoming less responsive to insulin signals. They stop opening the door as readily when insulin knocks. Your pancreas has to produce more and more insulin just to achieve the same effect. This is called insulin resistance. And it is not a sudden diagnosis. It is a gradual shift that happens quietly over years, often with no obvious symptoms until it has progressed significantly. Insulin resistance is directly associated with weight gain, particularly around the abdomen. It is associated with elevated cholesterol levels, high blood pressure, low energy, cognitive difficulties, and a significantly increased risk of developing type 2 diabetes. According to data from the Centers for Disease Control and Prevention, more than 1 in 3 American adults currently has prediabetes, which is essentially early-stage insulin resistance, and the majority of those people do not know it. This is not meant to frighten you. It is meant to show you how genuinely important the patterns we establish around food, and especially the first meal of the day, actually are for long-term health. The good news, and there is very significant good news here, is that insulin resistance is not permanent. The body's metabolic system is far more adaptable and responsive than most people realize. With consistent changes in diet and lifestyle, the trajectory of insulin resistance can be slowed, stopped, and in many cases meaningfully reversed. And breakfast, specifically the composition of breakfast, is one of the most powerful levers we have for influencing blood sugar patterns throughout the entire day. Now, before we get into the strategies, let me share some of the research that underpins all of this. A major long-term study from Harvard's The Chan School of Public Health tracked tens of thousands of adults over multiple years and looked at the relationship between dietary patterns and metabolic health. The researchers found consistently across different populations and different follow-up periods that diets dominated by high glycemic carbohydrates, meaning foods that raise blood sugar quickly, were strongly associated with higher rates of insulin resistance, type 2 diabetes, and cardiovascular disease. Importantly, this association held true even when accounting for overall calorie intake. It was not simply about eating too much. It was about the type of carbohydrates, specifically how fast they converted to glucose, and how aggressively they triggered insulin release. Separate controlled nutrition trials where researchers actually measured blood sugar responses in real time using continuous glucose monitors have shown something equally striking. 2 breakfasts containing the exact same number of calories can produce dramatically different glucose responses. A high-protein, high-fiber, moderate-fat breakfast can produce a glucose curve that rises gently, peaks modestly, and returns to baseline gradually. A refined carbohydrate breakfast with the same calorie count can produce a spike 2 or 3 times as high, followed by an equally sharp drop. Same calories, completely different effect on the body, completely different effect on how you feel, how clearly you think, and how hungry you will be for the rest of the day. That research is what the 5 strategies I'm about to share with you are built on. And I want to say something before we get into them because I hear this concern often. What do you normally eat for breakfast? Oatmeal, eggs, cereal, toast, maybe nothing at all? I am genuinely curious. Let me know in the comments below because I read them, and it is always interesting to see how different morning routines affect people's energy and focus throughout the day. If you have noticed a pattern in your own mornings, whether good or bad, share it. You might help someone else recognize something they had not connected before. All right, let us get into the strategies. Strategy number 5. Start your breakfast with protein. This one is perhaps the simplest shift you can make, and it is also one of the most consistently supported by research. Before anything else you eat in the morning, make sure there is protein on your plate. Now, most people know that protein is important for building muscle, but from a metabolic standpoint, protein does something much more immediately useful. It slows digestion. Specifically, it slows the rate at which carbohydrates are broken down and absorbed. When protein is present during digestion, it triggers a cascade of hormonal signals that tell the stomach to slow down, that tell the digestive system to take its time, and that help regulate how quickly glucose enters the bloodstream from whatever other foods you ate alongside it. The result is a flatter, more gradual glucose curve after the meal, but there is something else protein does that most people have never heard about. It stimulates the release of a hormone called glucagon like peptide 1, often shortened to GLP-1. This hormone is so significant that pharmaceutical companies have built entire classes of diabetes and weight loss medications around mimicking its effects. When protein triggers the natural release of GLP-1 in your gut, it signals to the pancreas to release insulin more carefully. It slows the pace of digestion, and it communicates directly with the hunger centers of the brain to reduce appetite. This is why a high-protein breakfast can suppress hunger for 3 to 4 hours in a way that a carbohydrate-based breakfast simply cannot match. Foods that provide a meaningful protein contribution at breakfast include eggs, which are one of the most nutrient-dense and versatile options available. Plain Greek yogurt, which is significantly higher in protein than regular yogurt. Cottage cheese, which many people forget about, but which is an excellent and affordable source. Tofu or tempeh for those who prefer plant-based options. Nuts and nut butters, though these are better combined with other protein sources since they are also high in fat. And legumes like lentils and beans, which some cultures have eaten for breakfast for centuries and which are now being studied specifically for their benefits in blood sugar management. A controlled nutrition trial published in the Journal of the American Diabetes Association found that participants who ate higher protein breakfasts compared to matched lower protein breakfasts with the same total calories experienced reduced blood sugar spikes, lower insulin responses, decreased mid-morning cravings, and reported feeling significantly more satisfied and focused throughout the morning. One important mistake to avoid: many people add protein to their breakfast but still pair it with large amounts of refined carbohydrates, a protein shake alongside a bagel or white toast, eggs alongside a glass of orange juice, and a bowl of cereal. The protein is doing its job, but the volume of rapidly digesting carbohydrates alongside it can still produce a significant glucose rise that partially or completely cancels out the stabilizing effect of the protein. The key is balance, not just addition. Strategy number 4, include healthy fats in your breakfast. For many people, this one feels counterintuitive, and I understand why. For decades, dietary fat was positioned as the enemy. Low-fat diets were promoted as the path to better health and a healthier weight. Most of us grew up with that message, and it is hard to let go of. But the research on dietary fat and blood sugar tells a fundamentally different story. Healthy fats, the kinds found in whole, minimally processed foods, do something specific and very valuable during digestion. They slow what is called gastric emptying. All that means is that food moves through your stomach and into your small intestine more slowly. When food moves through more slowly, everything that follows is more gradual. Carbohydrates are broken down more slowly. Glucose enters the bloodstream more slowly. The insulin response is smaller and more proportionate, and the overall arc of your blood sugar after eating is flatter and more stable. There is also a fascinating finding from recent research on olive oil specifically. Extra virgin olive oil contains a compound called oleoanthol, which has been shown in studies to have properties that reduce inflammation in the same biological pathways that are disrupted in metabolic disease. Chronic low-grade inflammation is now understood to be one of the key drivers of insulin resistance over time. So olive oil is not just slowing gastric emptying. It may be actively supporting the cellular environment that allows insulin to do its job properly. Using olive oil to cook your eggs in the morning is not just about flavor or tradition. There is a genuine metabolic case for it. The foods that provide these beneficial fats include avocado, which has become widely available and is an easy addition to eggs or toast. extra virgin olive oil, which can be used for cooking or drizzled directly over food. Nuts, including almonds, walnuts, pecans, and cashews. Seeds, including pumpkin seeds, sunflower seeds, hemp seeds, and sesame seeds. And fatty fish like salmon, which some people incorporate into breakfast in various cuisines around the world. Many people are genuinely surprised when they learn that adding fat to their breakfast, adding avocado to